Får jag ta den här nere där? Ja. So there's 3 minutes left. Koksalt. And then if we remove the safety, you can see the sharp needles. And what we're going to do now to remove the tumors from the periost is to inject some saline.
Ska vi köra test?
Har du injicerat eller?
Nej, men den är inte färdig än.
Nej, men jag tänkte, just det. Men det kan man väl göra innan. So this is to dissect the tumor from the bone. So this is just saline. It's no drugs in this.
Yes, no drugs.
Just to heighten the tumor, remove it from the bone. So we can treat deep margin without bending the needle.
Fourth swelling.
Yeah.
Fourth swelling. Okay.
De där har du injicerat också.
But I think I'll do the injection. Otherwise it will...
Yeah. So now we're going. It started. We have an active machine now. You want the foot switch. Oh. We do a check first. See that it's working. You can do this when you have the needles in the tissue also, the measurement before and after.
Okay.
Yes. So now we can start treating. And now we want to check to see for spikes on the ECG also.
And what's here?
This is a it's a measurement of the impedance actually in the tissue.
Yeah.
So you can do it with the needles in the tissue also.
Okay.
So, let me see. Let's see on the ECG also maybe. So there are 8 pulses, 0.1 millisecond. It's so fast. It's
You see? On the...
yes. These are and also if you see on the ECG.
Yeah.
And you have done 5 applications now.
It
Yeah.
shows the half-eye.
So far so good.
And then I switch.
And you rotate, as we talked about, the different directions of the cells that they are. Because the cells are not perfectly round spheres, they are elongated and irregular, so we have to treat from every side to cover it with the electrical field. And you see, this is done without muscle relaxation. There's no problems at all. So this could probably be done in local anesthesia if the patient is okay with it.
And not to be afraid of pushing it.
No, you should be afraid not to push it, because you need to treat the deep margin also. Otherwise, it doesn't work. The needle's okay, so.
EKG lite också, eller?
And we have 15 minutes to go, so it's a lot of time. No hurry.
It seems that 20 minutes short time, but
Yeah.
we are doing it.
It's plenty of time. I treated 60 lesions in breast cancer in 20 minutes, so it's plenty of time.
How do I know how much I have to do? I'm not sure, but I do it a lot.
Okay.
Yes. To be sure and feel good, covering all the
Yes.
angles.
It doesn't hurt to do a few more times extra. So we have done 21 applications now, and everyone is successful, no problem so far, without except for the needle that was bent.
Okay, I think we had a saline.
Again, this is only to move the tumor away from the bone.
We found this to be more convenient. It's just
Yeah. It's in no protocol, but we use it to think it's good in these cases. Do you see anything on the ECG? There should be spikes there.
And I do it with some kind of margin. I don't measure, but
We should aim at least 5 millimeters for palliative treatment and at least 1 centimeter also at the deep margin for curative treatment. And in larger tumors, ultrasound is helpful. So 34 applications. Nine minutes to go. So it's no rush. And I think you have to update the device to allow for the 40 minutes window in the next update. 48 applications so far.
So how, what the most,
We've done, I think, 200.
yeah.
So there's no limitation in the amount
Yeah,
of.
there's no
It's just the
amount,
time. That's the limitation.
Yeah, the limitation of the time is.
Yeah. So if you can do 1,000, you can. If you have time to do 1,000, you can do that.
I mean, the needles will go in like 5-6 millimeters, I think, maybe 8. But if the tumor is big, we can go to the blue line here.
So yeah.
We put it through.
And in the development, we also need longer needles for the larger
needles,
tumors. So that's coming. Probably to have a stepwise increase from 1 centimeter to 2 and 3. The problem is if they are longer and thinner, they tend to deviate, and then the electrical field will be.
Keep this centimeter.
Yeah, if there are 3 centimeters and they are thinner than this, they tend to deviate, and then the electrical field is too low to cause electroporation. So there's a trade-off between the thickness of the needles and the electroporation. So we'll have 6 minutes.
The question, pain. Do they have pain after?
Yeah.
No, this man, he says it's itching a little bit.
Itching.
Tomorrow.
So the question, if you're listening over at the clinical training center, was if there's a lot of pain after treatment. In this case, there's not a lot of pain at all. When you're treating on skin metastasis in the oral cavity, it's a different story. They have a lot of pain.
A lot of pain.
Yes. Most of these patients, we give them fentanyl patches for a week or 2 after treatment.
But also sometimes that they have pain when they are coming with the
it's correct.
All these
Yes,
patches
yes.
and anything else.
And the pain can actually decrease the first days after treatment and then increase.
Then increase,
Yeah. So I think we're almost done here. It was 72 applications. Everyone was successful. We have 4.5 minutes to go.
But we finished.
Yeah. Usually we do this faster, but
They will fall off.
And we will put something on that tomorrow or something.
Yeah,
some dressing.
some dressing maybe tomorrow and the day after. But we have to shave his head now because he has not have a cover when he came.
no. So within a week they can be totally without a cover.
Less than that.
They said it dries up pretty fast. Yeah. But in the neck, for instance, it can have a secretion for a week maybe, and then it's dry. Ja. Kan jag ta det? Ja.
Ingrepp har utfört då? Det jordligaste fel som vi sa. Inget annat.
Antagligen som jag tar fram kunde räkna med ingrepp reparat, någon kvinnoutrustningen. Postoperativt omhändertagande då?
And afterwards, you can have the treatment in the database, so you can go back and see how you treated the patients. So it's saved in the database.
Ja, telefonnummer.